Welcome to the Australian Society of Anaesthetists Anaesthesia Recipe Book. In this video, Dr. Mark Sinclair shares his expertise in providing deep sedation to patients in dental surgeries. That is, for people who are not in hospital but attending a dental practice. He gives us insights into what makes this practice safe. There are some major things to consider, particularly in terms of safety if you are considering taking on this type of work. We also aren't talking about light sedation here, which is what occurs quite safely in many settings around Australia. We are talking about deep sedation. Anything where the patient is not able to answer questions and obey commands to move their body, such as "give me a thumbs up if you're okay," is considered deep sedation and should be provided by a trained medical specialist, such as a specialist anaesthetist or a GP anaesthetist. Basically, if you can give deep sedation, you should be able to provide a general anaesthetic, because if you know, you know. There's not much between them and things can go south very quickly if you're not prepared. If you'd like to know more, then please refer to the ASA's position statement on deep sedation. That is PS 26. It's now available on the ASA website. There's also the ASA position statement number 14, that's 14, which is called Anaesthesia for Office-Based Surgery. Just go to the policy section and look for position statements. Of course, I'll put a link to them in the notes below. But in the meantime, let's get into it.
Well, my name's Mark Sinclair. I'm an anaesthetist practicing in Adelaide, South Australia, and I've been involved in dental sedation work for over 20 years and done somewhere at the order of 1,500 cases. The typical procedures that I'm assisting with are dental extractions or dental restorations. The procedures go ahead in the normal dental surgeries in a typical dental setting with that semi-reclined chair. I try to keep them to a 2-hour booking, which normally means about an hour and a half of work and half an hour extra time for recovery and so forth. I try not to do any longer than that, because I do find that patients lying in a dental chair do get a bit physically uncomfortable after a while. Mostly it tends towards the younger patients, having either extractions, wisdom teeth extractions, or restorative work. Because of the unique setting, we tend to select the healthier patients, ASA 1 or 2, younger and middle-aged. In recent years, with the aim of improving safety, many state governments have got involved in this issue of sedation techniques in out-of-hospital settings. And I think possibly now all states do have some sort of legislation in place governing what you can and can't do in an outpatient setting. It varies from state to state, and so it would be important for anybody doing this kind of work, perhaps check with your local ASA committee. When I assess a dental surgery for suitability for sedation, which I don't have to do very often these days, but I will still go and have a look and make sure that I'm happy with the layout. The other aspect of it is that, especially when I'm out in a rural setting, they're very happy because they can stay home. The partner doesn't have to come down to Adelaide with them. They don't have to find accommodation. They can simply wake up in the morning in their own home, go to the dental surgery and go home afterwards, and the partner perhaps just needs that one day off work. It's a little bit daunting for some people, and I know and I understand that many anaesthetists don't want to be involved in this sort of work, and probably some of the stuff that I've talked about will put them off even more. Having to obtain all your own drugs, equipment, resuscitative drugs, the fees having to be charged, the work you have to do to put into it to make it work, and to make it work safely and keep the patients happy as well as safe. But overall, I must say that it's been a very rewarding part of my work. I certainly do very well from the point of view of enjoyment of the work, feedback from the patients and from the dental surgeries. You're usually facing a very grateful, happy patient. In many cases, some of these patients have not seen a dentist for years. Some of the patients are even just having simple hygiene, clean and scaled. They can't even manage that in an awake state. And so the improvement they get to their dental health, and I would also hope therefore their overall health, is well worth the effort. And I've had some patients come back 6 or 7 times over the years for restorative work, going from a very poor set of teeth to a very healthy, robust set of teeth, and very happy and very grateful for the service having been provided. So it's a good vibe, a good positive vibe that I get from this sort of work.
Well, that's all we can share with you from this video out of respect to our generous contributors. The rest of this video contains some handy tips that you won't find in any of the textbooks and is only available to ASA members. I'll put a link to it in the notes below. Otherwise, if you happen to be surfing the internet, it can be found on the ASA education page on the ASA website. I hope you enjoyed it, and thank you for watching.